intimate partner violence. I'll start again. I'd like to take this time to talk about this whole issue of traumatic stress and what relationship that has to intimate partner violence, but also what implication it has for how kids are doing in this program when they have this issue. So why is this important? Well, we're going to define traumatic stress, PTSD, the extent of this for women and kids. We're going to look at how it affects women and children with IPV families, and then issues that it brings when we're trying to help kids to provide services for them. So why is it important? Because some of the kids who come to us for help may have suffered from traumatic stress, or they may even have a diagnosis of post-traumatic stress disorder. And that was a diagnosis given originally to men who came back from war because they had seen something that was, quote, outside the realm of human experience, that threatened their very survival. And when the definition was applied to other circumstances, it was used to understand what rape victims had been through, their complete obliteration of their sense of trust, their sense of what's usual. They might have thought they could be killed, etc. So post-traumatic stress disorder is related to something extremely stressful that threatens your life or threatens your view of the world or your complete sense of who you are, sense of safety. And lately, it has more been described to in the DSM, which is the Diagnostic and Statistics Manual, where we give people a diagnosis as counting traumatic events. One of the events is intimate partner violence. And so either having it happen to you or witnessing it is considered a trauma for people in terms of psychiatric research. And so kids who are witnessing domestic violence, especially little kids, may think that their life is over. Their parents are going to be killed. The police will come take dad away. You know, things are going to be destroyed. And you can tell them all you want, but their experience is such that it's so terrifying. Remember the little kids sitting up on the stair, watching what was going on in the family, being traumatized. They may have behavior that's kind of unusual. It could even be mistaken for ADHD or aggression, when in fact they have been traumatized. So we have to be careful to understand it before we kind of give kids Ritalin or whatever. And recognizing the symptoms, we could make a mistake. We could make it worse because you could overlook what's happening and just, again, medicate the kid or treat it for the wrong thing. So what is a traumatic event anyway? Well, these are kids' drawing of the World Trade Center bombings. That certainly was a traumatic event. Everybody would agree on that. It was traumatic for every single person. I don't know how old you are out there, but, watching it over and over and over on television, trying to make sense of it, it was mind-blowing. But it wasn't traumatic for those who didn't know somebody or who weren't right there as traumatic. So events that are threatening yourself, sense of self, or an actual death or injury, like you're threatened with death, can have a reaction of fear. You're terrified, you feel helpless, etc. Across the lifespan, there are all kinds of things that are traumatic events, like natural disasters, hurricanes, fires. Illnesses and accidents are traumatizing, getting cancer. But then man-made events are traumatic too, like war or 9/11. The death of someone close to you can be traumatic. What kinds of things are kids exposed to that might be traumatic? So, very specific events happen to kids. Physical abuse, 14% of kids report physical abuse. And I don't mean spanking. We're talking about using an implement, causing harm, etc. 27% of girls, 16% of boys are sexually assaulted before they reach the age of 18. And the rate for kids in college is big. Emotional abuse, it's very hard to document that. Most of the people who are like taking advantage of kids that way, emotionally abusing them, putting them down, shaming them, 80% of those perpetrators are the kids' parents or other relatives. But 24% of people report emotional abuse during childhood. Traumatic events that you hear about that make the newspaper, like kidnapping or school events, school shootings, extremely, extremely rare, less than 1%, less than 1/10 of 1%. But these are the things that kids are going to run into. And if you're going to have a traumatic event as a person, it's more likely to have happened before you turned 18. And 15 million kids are exposed to IPV every year. 39% of all American kids are exposed to at least one traumatic event a year. So if you're exposed to these things, they don't just happen one time. Can kids be traumatized if they watch IPV? That was an early question because when I started studying this, people said, you're going to look at trauma for them? Come on, they're just watching fights. I said, let's try, let's see if it's true. So how do you get a diagnosis of post-traumatic stress disorder? Well, first you have to be exposed to a traumatic event, right? And that is IPV witnessing for kids. Then you have to have certain kinds of symptoms. So it can be recurrent memories that you don't want, they're intrusive, traumatic nightmares, dissociative reactions, physiological reactivity, you get all physically aroused, or you can have avoiding thoughts and people, avoiding reminders. You can have change in how you think and your mood since the traumatic event. And you can have alterations in how you respond. You can be very irritable and edgy, but you can be hyper vigilant. You can be on guard. You're watching all around to see if there's danger, if something's going to happen. All of these things are in the service of keeping you safe. So you might be reacting a lot to things because a bad thing could happen. Now you're just going to get away from it. For kids, they might be more fearful and anxious. They might be afraid the stressful event's going to happen again, so they're really watching for it. They might be very hypervigilant, like on guard. I know when I do these groups, if I walk into the room, all the heads turn right away for these kids. They want to know, am I drunk? Am I safe? Am I going to hurt? Am I the evil, angry person? What's going to happen? They're very tuned in. And that takes a lot of energy. They're very reactive. If you make a big noise, they might jump like a trauma victim would. They have intrusive thoughts. I worked with a kid who was 16. She was in math class, and suddenly the image of her mother's face was wafting across the blackboard. She'd just been beaten up the night before. She didn't want to remember that, but that image is in there, and it comes up at times as very disorienting. Kids trying to forget, they don't want to talk about it, they don't want to remember, they don't want to be around people who remind them, but in fact, sometimes they have visitation with the person who was the scary person, and they have to go there, and that's really terrifying to some children. Social withdrawal, being very flat, I don't have any feelings. I worked with a kid who was traumatized, and for a couple of sessions, he came in and acted like a robot. And I said, why? I don't want to have any feelings. I don't have any feelings, he said. It's just too hard. It's really hard to get through those feelings. So sense of numbness, they just pull away. Those of you who have children more than one, this may be a familiar picture. But kids who are traumatized may develop regressions. And that means things they used to be able to do, they don't do anymore. Like they suddenly start wetting the bed, or they have trouble talking. I had a kid who went mute for a year because he was so traumatized. Separation anxiety, when they were fine with it before, now they're scared and they're clingy. Aggressive behavior, more so since the event. It's because they're nervous, they're scared. And traumatic play, age inappropriate behaviors. They might suck their thumb again, they might be very clingy, etc. So what role does traumatic stress play in how violence affects kids? Those are generally ways that kids show traumatic stress. Now, what about the violence? Well, whenever something traumatic happens, people have three ways of dealing with it. One is taking action. That's the first part of your brain to develop, the lower brain, where it teaches you to keep breathing, to get up and go, etc. Or you can process emotions during an event that's going on. If you're more alert, you have enough time, now you can start to think, well, how do I feel about that? And that happens in the midbrain that develops more slowly. It develops after when kids are starting to grow. But thinking about something, cognitive processing occurs in the forebrain. And that happens, that's the last part of the brain to develop. And so when we have a terrible event going on, the stress response is three things. You've heard of this. Flight, the first thing is something's happening, I'm going to go, and action, getting out of there. Or you freeze, like, I can't go that way, I can't go this way, I'm stuck. Like when you're being assaulted, you can't get up and go. That is traumatic, and people can then fight back. That's another option. And some kids will try to fight the aggressor and try to stop the fighting. Very, very dangerous thing to do. So this is how people generally react to stress. Well, you can see when there's chronic violence that, you don't have a lot of options here. Kids are often stuck watching it. They can't get out. They can't leave the house. And so they may try to fight, but they're typically just sitting there being traumatized. Okay, so when we see these kids who are in therapy in the groups, they may have trouble regulating their feelings. They might be very easily upset, or they might have trouble down regulating, trying to calm down. And again, it's from being on edge, and constantly being traumatized. They may not even want to talk about it. I don't want to say anything. And in our programs, you don't have to talk. You can just sit there, do the activity, whatever. They may isolate themselves from the group. They may not be able to talk about things or even bring up the idea of feelings. It's too, I'm not going to go there, scary. They could be very upset or jumpy because we don't know what happened last night when they come in for the groups the next day. They could be very, very upset. They could be on guard, very wary, hypervigilant, especially at the beginning. So the whole goal is to make it safe for them. So how do we know if they have traumatic stress or if they have PTSD? Are there any questions before we get into the research on this?
No questions, Sandy.
Okay, clear as mud, right? Sorry. All right, let's just move ahead. So we did a couple of studies. One was a bunch of people in the community. They were people who said they had they had fighting in the family, but they weren't coming in for help, and they were not living in a shelter. They were living in the community, and there were 64 kids in that study. The second one is the 221 kids who participated in the Kids Club evaluation, and they came to the program because the same reason, violence in the family. All the kids in both groups were 6 to 12 years age. So this is school age kids. We use this trauma symptoms checklist. It's only 17 items, and it's a report on the kid's reaction, whether the symptom occurred, and whether it lasted for more than a month. And that was the criteria for it. So we said, does this child have any intrusive memories of the violence, dreams or nightmares about it? Acting out, perceptive play, trying to play what happened to figure it out. Do they get upset when somebody mentions it or they remember it? Or do they just avoid thoughts and feelings or activities related to it? Have they forgotten parts of what happened? Do they have less interest in things, more isolated or detached? How about reduced feelings in general? Do they have no sense of the future anymore? They don't want to talk about long-range plans. Kids who are very depressed often do that. Sleep disturbances, is it different than it was before? Trying to figure out what about the violence and the traumatic part of it has changed the child. Are they more angry and irritable? Not that they always were, but since the most traumatic event. Do they have trouble paying attention? More alert or on guard? More jumpy? Or do they have a physical reaction, like if they are reminded of it, they start sweating or shaking, just fear? So here's what happened. We grouped these symptoms into re-experiencing, avoidance, or being physiologically aroused. And in the first study, the community people, 52, every time I touch the screen, it moves. I'm sorry, I'm trying not to do that. 52% of the people had traumatic re-experiencing. And in study 1, 19% had avoidance, 42% had this physiological arousal, and 13% actually had a diagnosis of post-traumatic stress disorder. The second study was people who came for the intervention program, so it's a more clinical sample. 77% had traumatic re-experiencing, 59% had avoidance symptoms, 85% had this traumatic arousal, but 51% of those kids were diagnosed with post-traumatic stress disorder. It was stunning. So if you use the criterion from the DSM and you evaluate each aspect of it, this is the kind of information you get. And even if we had one kid with PTSD as a result of domestic violence, would be way too many. But these kids are going to school. They're playing in sports teams rather. They're going to clubs after school. They're hanging out in the neighborhood. And they all, the kids in this group are traumatized. They're not in their right mind in a sense. Someone's at my door. Could I take 1 second? Literally 1 second. Don't ring the bell. On mute. Okay, people in that study on ages 6 to 12, average was 8.5 years. Moms were about 33 years old. Monthly income was low, but it varied a lot. And maternal education, most of the people had more than a high school degree, so some kind of training or college. Oops, here we go. Ethnicity for the people in that study, about half were white, 52%. And the rest were of some other ethnicity, mostly African American, 32%, or biracial kids. Very few Hispanic and almost no Asian. And that's why after this study, we designed the evaluation of the Latina program. And we had 100% Spanish-speaking families in that one. So many kids have PTSD. This is another way of saying the same thing. Whether the child had PTSD really depended on the sample, as we could see. So when you say half of them have it, no, it's the people who come for certain kinds of help. But most of the kids you work with will be having some of these symptoms, at least some of the symptoms. We didn't find someone with no symptoms. Okay, so what about risk factors for PTSD for their moms? Well, demographic factors matter. The more, lower education, younger age, more stressors, et cetera. Those are things that contribute to risk for PTSD. If a woman has a history of depression and then becomes, exposed to a traumatic event, more likely to have PTSD. And the more events that happen, it sort of wears people down and they become more likely to have PTSD. So around violence, that's related to it. If there's physical injury, these are things related to more trauma symptoms, more frequent, more severe, higher levels of violence, substance abuse. If you think you're going to be killed, if you've had more than one partner in psychological abuse, the more of these things the woman's exposed to, the more likely she is to have PTSD. Now, it kind of works the same way for kids. So let's look at that. We can see younger age, more stress in their life. Lower SES just means less resource, more stress. Kids' mental health, if they're doing well before the most traumatic event, they're going to do better. They have more, to cope with. Mom's functioning, if they have a mom who's doing better, it's all the same things. Who's going to be more resilient? Well, these are things about who's going to get PTSD. It's the same idea. If there's witnessing violence, the more close they are to the events that are happening, the more times they've experienced it firsthand, and then all of the other aspects of violence that could be going on in their life. The more of these you have, it's a dose-response relationship. The more negative events, the more likely you are when a bad thing happens to be over in that line where you would have PTSD. That's pretty shocking. And the interesting thing about this, not much you can do about a lot of demographics, but all of these things we can address. These are all amenable to intervention. It doesn't have to be this way at all. But the expression of trauma, how it shows up, is different depending on the age and developmental stage of the kid. And it's helpful when working with the parent to help them understand that there are differences for kids of different ages. And we want to adapt the treatment to their needs. I want to take one more second now to show you something that makes the case for when kids are younger, the effects are going to be greater because it's all about the developing brain. Bruce Perry is a MD, was at University of Texas, who now has his own institute, who has been one of the first and best people actually to study this issue. So if I can share this video with you, I think it really makes the case, because a lot of people say, well, they were young. Older kids get more affected because they're able to see it and they can talk about it, and all of those things. Well, after you see this, I think you'll appreciate how it really is the younger kid who has the most difficulty with this. So let me see if I can share this and we can go on. All right, we're actually getting there. This is great. So let me do full screen and hopefully I still have this. Okay, so this again, there might be a little bit of advertising in the beginning, but it's 14 minutes and I think it makes the case for why young children are going to be more traumatized by exposure to IPV.
Because of the way the brain works, you will always remember your very first roller coaster ride. Storing these new experiences is one of the brain's main jobs. In fact, your brain creates a mental blueprint of every new experience you have. A blueprint for any new touch is stored in one part of the brain. A blueprint for any new sound in a different part. And a blueprint for any new sight in still another part. But as powerful as that first roller coaster ride was, it can't compete with the lingering effects of your brain's earliest experiences. Although you have no conscious memory of this part of your childhood, it is these very first experiences that literally become the building blocks for your whole life.
Unlike other organs, the brain is undeveloped at birth, and it is waiting for experiences to shape how it will develop. The amazing thing about the human brain is that the younger you are, the more sponge-like your brain is, which is the reason that children in 3 years can learn language, can learn to walk, can do all kinds of incredible things. But the very same biological sponginess that allows us to rapidly acquire language is also the same sponginess that makes young children more vulnerable to trauma than older children.
We have the opportunity to do police ride-alongs to a domestic violence situation. And so this was actually the first call I ever rode along. It was dinner time and they were having spaghetti for dinner. It was dripping down the walls. The kitchen table was overturned. And we had 3 children in the household. Looking at this whole situation at the time, we said, no evidence of physical harm. The kids are fine. We learned differently, of course. The boy in the corner was classic behavior that we see with kids who have had chronic exposure to violence. He would just completely zone out, numb out as things started to get scary. The 6-year-old little girl on the chair blames herself for what's going on. But actually, it was 4 years later that we really appreciated who had some of the most profound or severe harm coming out of this situation, and that was the 6-month-old baby who was now 4.5 and had seriously injured another child in preschool.
It's literally the opposite of the way most people think about this. Most people think young children, they don't really understand what's going on and they're resilient. But the fact is, if anybody's impacted more severely, it's the younger child.
The brain is put together like building blocks in a sense. Those first blocks that go together are the more primitive area, the survival brain.
The brain develops from the bottom to the top and from the inside out, so that the normal development of the top part of the brain depends upon healthy development of lower parts of the brain. The top part of the brain, where you do all of your thinking, is the part of the brain that is most changeable, easiest to modify. But unfortunately, if a child has developmental experiences of threat and exposure to domestic violence, the lower parts of the brain will be impacted and they're harder to change as they get older.
He was never physically abusive, but he was verbally abusive. There was lots and lots of screaming in front of the kids, berating, putting me down, and they pretty much heard it all.
Children exposed to domestic violence, children who witness their parents fighting, literally are experiencing a state of fear. And when this happens, the systems in your brain that are involved in thinking at the top part of your brain are literally shut down. It changes the brains of these children.
My son has seen and heard a lot of the violent outbursts. He was experiencing night terrors, and that was probably his way of dealing with it, because in his waking state, he didn't know how to articulate at 2.5 years old. So it was coming through, when he was asleep.
When kids are chronically stressed, one of the problems that we see is difficulty in attachment, in bonding, because they're so focused on survival. It's hard for them to reach out and connect with others.
My oldest boy went through a stage where he would bully his younger brother and seemingly laugh in glee. He was not remorseful or had no empathy that he could actually make someone cry. Many, many phone calls of him being disruptive in the classroom. He was a very bright kid, but that's when I knew that he was heading toward trouble.
A lot of these kids get labeled as being, bad, difficult, defiant. This is a very natural response to their circumstance. What the child is doing is a survival strategy for them, but it creates behaviors that are very difficult in the classroom. When they're in a crisis mode, they can't learn.
The tragic reality of children growing up in domestic violence is that they end up with mental health problems at a rate higher than children who are actually the direct victims of physical abuse.
My mother was a victim of domestic violence. My father was an alcoholic, a drug user, and just a cocktail for bad living environment for children. My brother, he looked like he was crying on his way home. Me not knowing, I was just a careless little 6-year-old, seeing him climb up to my mom's medicine cabinet. I asked him what he was doing, and he boldly said, I'm killing myself. 8-year-olds don't talk like that. First person I got the call was my best friend's mom. By the time she came down to our apartment, he had a butcher knife in his hand, just cutting himself all over his body. And I was just bawling, just crying. There was nothing I could do to help. My brother was crying. He didn't want to be there. He was trying to run out. But I had already known that my home, wasn't my home. It wasn't a place where I felt safe.
Childhood exposure to violence is about living in a threatening, scary environment that may escalate to physical violence, but it often doesn't have to. It's the chaos, the uncertainty, the fear of being in a home where things aren't okay. Very interesting talking about the roller coaster, because that's what we hear from adult survivors who are in violent households and also the children. The hard part for them, I think, is thinking about what is normal instead of this up and down life of being in a violent, threatening relationship.
Growing up in my home, there were 6 children. My mother and father, unfortunately, fought like cats and dogs. As a result of that, 2 of my brothers ended up being batterers. I have 2 sisters. Even today, they date men that batter them.
Exposure to violence is a lifetime legacy. We see that adults who have had negative childhood experiences often have coping behaviors that can be unhealthy. That certainly has huge effects on how one is going to parent.
It's really important for parents to understand that their internal state, whether it's calm or whether it's alert engagement or whether it's frustration and anger, whether it's sadness, depression, the baby absorbs these internal states.
I have been in the moment with that sense of helplessness and hopelessness and stress and anxiety and rage. It really damages the brains of small children to be under a constant level of stress and anxiety. Every day, I hope that I haven't damaged my kid in any way.
They need to see from you as a parent how to deal with stressful situations in an appropriate manner, being rational, not resorting to violence to deal with situations. Your children are going to learn how to deal with stress from you.
Luckily, my older son is verbal enough and is old enough now that we have conversations about how did it make you feel when that was going on? Was that scary for you? Yeah, and validating that.
The biggest thing that helps children exposed to violence is to be able to talk about their feelings, get those critical messages. It's not your fault.
Any conflict, I'm able now to stop before I add to it. I'm able to step away rather than trying to solve it at that moment in a state of heightened anger.
Just try not to go through it alone. If you have a strong support system, and know what avenues you have available to you, in case you do need to get out. I was glad that we got help when we did.
One of the great things about brain science that we've learned is till the day you die, you have the ability to add new neurons in your brain, that the brain is more like skin in the sense that it can rewire and heal itself in the most important area, the cortex. We have the capacity to heal and do better. The biggest thing we can do for kids exposed to violence is how many healthy adults can they connect to?
I did a lot of my childhood in other people's homes. So I saw what positive relationships were about. I saw my friends were normal. They didn't have the rage I had. Seeing parents that were together, that showed affection, home dinners where everybody sat together. Those are the things that I realized were important. And instead of being envious, I incorporated it into my life. I wanted to be a part of that.
I know school is what made a difference for me. The teachers, the attention I got, letting me know that I could be somebody and I could do something.
In fact, my oldest son, his teachers, all 6 of them were very instrumental in coming forward and providing him support when he needed. They allowed him to be homeschooled to give him time to heal.
The hardest part about being a parent now is trying to be different than how my parents raised me. Am I being a good father? What do I need to do to help you feel safe in your home?
That's the part, the brain development part, that I think you want him to know what normal is for us. And normal is having people who support you and who love you and who want to take care of you. And that want that to be his normal life.
It's one of those pay me now or pay me later. And the truth is, children who are good at self-regulation, good at self-soothing, don't cry very much, and end up being, if you will, successful, are children who have had incredibly attentive early caregiving, which some people, unfortunately, think of as spoiling. It's exactly the opposite. Rather than spoiling the newborn, what you're doing is you are building in healthy self-regulation.
So those are the things that I want to create an environment for my baby where he gets the benefit of what I've learned from all these experts and also other parents. And believe me, they're experts too.
The most important thing that parents need to understand is that the brain of their child will become exactly what the child was exposed to. If you want your child to be kind, then you have to be kind to your child. If you want your child to be good at self-regulation and not lose their temper, you have to not lose your temper. And that's the beauty of the human brain. It is a mirror to the child's developmental experience.
Okay, let's get back to where we were. It's an important thing to understand, but it's not the whole story. Definitely, it's one thing to say your child's brain will be exactly what's reflected in the environment, but there really are kids who are dysregulated for all sorts of other reasons, who have diseases, who have very physical limitations, etc. But in general, the idea that the developing brain is absorbing the surroundings is just absolutely critical, and the ways in which a lot of distress affects various parts of the brain is really important to understand too. And if nothing else, I mean, I think it helps us see why kids are affected the way they are, but also that it's hopeful that we can change that. We can build in other ways of understanding and other ways of coping. So I thought it was great information, and I wish every parent could see that when they hand the baby to the parent to leave the hospital. They should have a small stop outside to watch that video. That would make a difference, I think. Anyway, just as Bruce Perry was saying, attachment problems are one ways that, kids who are traumatized can be dysregulated because they don't get the attachment. Maybe there's severe neglect that will make trauma symptoms worse too. Kids who are traumatized as infants may have sleep problems. They don't sleep as well, or they have eating disruptions, vomiting, refusing to eat, etc. Certainly their brains are affected. In young kids who've been traumatized, again, they might regress to different activities, things they used to be competent in or progressed in, and now they're kind of backsliding because they're so dysregulated. So around, toileting, clinging, people being, needing that blankie or that special transitional object when they sort of discarded it years ago. Being disorganized, engaging in risky behavior. I worked with a kid who was 6 and he was trying to jump off the second floor balcony of his house. He just was so distressed, he just wanted to get out. Emotional reactivity, again, eating and sleeping problems for young kids. And if you're the mom of a young kid with a sleeping problem, your day is not good because you wait for that final moment when the kid finally conks out, gets to sleep for the night. Then you get the chance to do all the other things you couldn't do during the day. But if that kid's dysregulated, can't sleep, it adds again. So the distress and the trauma, they go around and around. It's not like it's just affecting one person. And then it affects all the siblings in the family too. School age kids, we talked about the ways in which trauma symptoms show up there. And certainly older kids, very dangerous ways that trauma symptoms can be dealt with. And they're trying to deal with them with these issues, trying to get more attention, trying to get closer to people, trying to get more attached, trying to blunt the pain using substances, drinking, drugs, etc. There are lots of reasons why trauma symptoms, eventuate in certain kinds of behavior. So what about parenting after traumatic stress? Because the parents have been traumatized, the mom certainly, if she's a survivor. But it's a double whammy when both the parent and the child, it's all happening in the same family. They're traumatized by the same event. So people try to treat the trauma in one person and the trauma in the other person, but in fact, these things are related. And what happens if the parent is the perpetrator of the child's trauma? That parent is still there. The threats are still there. The reactions just keep going and going and going. What about if the parent is debilitated? The kid's all traumatized and upset and really, really struggling, but the parent can't attend to it. The parent can't help relieve it. And that just, again, keeps it going. It's also traumatic when there's court involvement, because now you have other people looking in, you have other people evaluating what's going on. Sometimes this can be a relief to finally get to tell your story. You finally be heard. You can finally say what happened and hopefully be believed. But going to court is very, very stressful. even if you've talked about it 100 times, which most of survivors have not, when you're in a court situation, you don't know what's going to happen. It's out of your control again. And that's really, really stressful. And if, some kids, when they're traumatized in a family, they've been traumatized, but they're coping. They're dealing with it. They're getting by. They're not doing these negative behaviors. But if more than one of them has the issue, then you have even more to deal with. So the parents, you have to identify what's going on with the parent and the child, not just to try to help the child. We want to assess the coping of everybody in the family, but do it developmentally. Try to understand, well, what should you look for? What questions should you ask? Is your baby sleeping? Is there any change in your baby's feeding routine? Physical health symptoms and things like that. Looking at it by developmental age is very important, or you're going to miss it. If they're not getting suspended from the school, cool, but it's not like that. You want to help parents to be able to reduce their kids' trauma. And so even if they have a few symptoms, they haven't developed full PTSD yet, hopefully we can reduce that. We can address the symptoms and have parents being able to understand what's going on with their kid, you can be a lot more sympathetic if you think your kid's traumatic than if you think your kid's just being a little beast. There's a big difference. And we can help educate parents about it and help give them some ways of talking to their kids, kind of soothing it out, trying to make it better. Trauma-informed work also includes trying to look at the protective factors. So what has this family got going for it? Are there other people in the family who could come in and help if you're just working with one family? What are the protective factors for kids? Having kids be in touch with their friends is very important. If that can be arranged, that's going to help them to heal as well. And certainly, protective factors for the parent. What about resources? What about people who can come in? Providing a support program for parents when kids are traumatized, like the ones that we're doing. And proven interventions, using ones that are proven, evidence-based practices are very important because you don't want to make it worse. Another piece of advice would be, start early. You want to recognize the symptoms in even infants, even very, very young kids, because parents will say, oh, he's just a baby, a toddler. He was walking around, but he doesn't know what happened. Well, now we can see how he can be stressed, even if he's cognitively not aware to know what happened. So there are some children and some parents are doing okay, and others that we can really help. Doing okay is not the same. It doesn't mean you're going to stay okay, right? We don't know what sleeper effects are. Kids who are doing well now may continue to do well. They might get even better and stronger, or those very resilient kids, they might get worse over time. And so we have to try to build up as many skills and as much support as we can and empowerment for kids and moms as we can if they've even been exposed to this effect. And we have to coordinate what we help with the kid, help with the mom, and try to protect them from further exposure. One of the cool things we found in that 8-year follow-up study we did, it was only twice a week for 5 weeks when the kids were in preschool. Now they were 13. The ones who were in that program, even that short program 8 years ago, they had fewer violent partners. In fact, no new violent partners. All had left, and none of them had their kids exposed to that kind of violence for that 8 years. And we didn't intend that. We did not say our program's not prescriptive. You don't have to leave the violent partner if you're not ready. We try to take people where they are and help everybody get a little bit better, more empowered, have more skills, etc. Some people go far, some people go a little bit. But it was great to see that they weren't exposed to those violence events anymore. And that means they're not going to continue to be traumatized anymore. So we want to get programs that are proven to work. That's really, really important. A lot of people want to help, but if you don't really know what you're looking at, I think it can be a problem. So I'll have time for a few questions, but I want to say that, again, what started out as just a little volunteer job when I first got my job at Michigan brought me closer to this event, but closer to the community, not just the clinical office side of things. And that has made all the difference because I've stayed with communities, I've worked with various communities, I've learned more than I ever thought I would learn about this issue, but also about people and struggles. And hopefully by developing these programs and really adapting them for all sorts of different communities, but working together with people who are in agencies, who are doing the work, the providers, people who are, coming to the programs and learning. Every time we do a program, we learn more and more and more about what we could do better or who we could help and how. And so hopefully with these programs, we can have a future for kids where there is less violence in their life. They can make good choices. They can get all the supports that they need, and that they can begin to heal from the things that have happened in their past, both the mom and the kid. And I think after the survivor panel, we're going to hear a little bit more about what it's really like. We'll be able to see if these programs really do make a difference. So I hope to share some of that information with you. But again, it's the people who come forward, people who tell their stories, it's the providers, the people in the agencies who are doing this work. These are the people who are making a difference in this field. And, it would be such a gift if we didn't have another generation of people with this issue. But the more we can prevent it, the more we can help kids to become strong, the less likely it's going to be. So thank you for paying attention so long and hearing all about this program. But we do have a few minutes for some questions. Even just, wow, that was a lot. I'm glad it's almost lunchtime. That would be okay too.
Thank you, Sandy. Yeah, we do have a couple questions. The first one says, what are the differences of the effects on kids exposed to interpersonal domestic violence and kids suffering violence or abuse? And are there any differences?
Right. Well, as I think that's a great question, because there are some kids who are just physically abused. That's horrible, horrible right there. Some kids exposed to domestic violence, and some kids who have both. Remember, there's a 40% overlap. If a kid's been exposed to domestic violence, 40% chance that kid's also been abused, physically abused or sexually abused. And so, it's hard to separate those, but there are distinct groups, and some people have done those studies. I think you just heard about Bruce Perry, who said the kids who are exposed to domestic violence and kids who have physical child abuse, these kids have worse outcomes. That was stunning. Just witnessing being in that family versus being the victim, direct victim of physical assault. Those kids who witnessed domestic violence had more problems, more difficulties. So you can imagine the kids with both have even more struggles. But it's enough to just witness domestic violence to really derail, a kid's life. That was this. We've seen it in several research studies that compare those groups, but he made that point very clearly in the presentation too. So yeah, it's an issue.
Yeah, thank you. And then this is the last question. How can educators approach parents of children who are displaying symptoms of dysregulation if the parents typically respond with, he doesn't do that at home?
Yeah. We have two kinds of issues coming into the clinics. Sometimes it's like he's a horrible monster at home, but he never does it at school. He's great when he goes to my mom's, where the teachers never complain, but at home, all he does is fight and refuse it. And then we have the opposite where, he's doing fine at home, but, the minute he gets in school, he acts up, he can't get along with people, he's causing trouble. And so what we hear from both of those situations, this is a kid who is struggling, whether it's showing it outside the family, inside the family. If it's a family with domestic violence, there might be some reasons why the kid is not showing the issues at home, but will act out in school. One of them could be that they're going to get punished, that there could be repercussions. Go ahead, you just try to act out here and you're going to get it. Or, they're so scared because they see what happens to anybody who disagrees with the violent person, they're not even going to try it. So all that tension's still in there. All that, trauma is still in there. And the child goes into other settings and just lets it fly. So that could be one of the things if this is a family with domestic violence. Another thing that I've seen happen over and over is, when the child is with the mother, let's say there's a separation and visitation, the child goes to visit the abusive partner and behaves just fine. Not like the little boy in the video who lost it over lunch. But those kids don't act up. They're afraid. They're terrified. They don't dare, cause a wrinkle of trouble. Then they go home and they're wetting the bed. They're aggressive. They're falling apart because it's safe to do that. And so there are different scenarios that can explain, who are the people involved and why certain things are happening. But you'd want to ask a lot more questions. You want to find out. And a lot of times, parents, a hallmark of trauma is avoidance and denial, right? They don't want to talk about this. They don't want to say what's happening at home. And a lot of times parents who are struggling with violence at home, they may not want to see the trouble in their kid. They just don't want to see it. I can't believe that could be happening to my kid. Oh, he just ate something bad, or oh, he had bad a day, or too much homework, or they don't want to make the connection because they're ashamed or they feel so guilty. But sometimes it's the parents who make that connection. They're the ones who want to get help. I'm fine, but I want you to help my kid. We see that over and over and over. That's a really great way to get some of the women into programs, because you can advertise this is a great support program for you and a great support and skills program for your kid if there's been fighting in the family. Well, I'll go for my kid, but in fact, they need it just as much. So it's a wonderful way that we've seen over and over again for women who are really, I don't want to talk about that, or I'm in denial, or I'm too traumatized. I can't even go there. But my kid, I can see it in my kid. We've also had people come to programs when they said, I can take it. And it's not the physical stuff, I can get through that. It's all that emotional abuse. That's a thing that really gets right down to the bone. But when they start on my kid, and he hit my kid, or he threatened my kid, or he choked my kid, I'm out. That's it. Now I'm going to do something about it. And so this thing about how is my kid doing, that can go in a number of directions, but trauma plays into it. If it's IPV, there's a sense of shame, but risk, it's dangerous sometimes to try to get help. And so if a mom is worried about her kid, let's just get that kid in there. Let's see what's going on with that kid. Let's try to help that kid to do better. And along the way, we might just discover there are some other things going on that we can also help. So I don't know if that answered your question, maybe more confusing, but those are the cases that I've worked with, and those are the issues in the research that I read about too.
My sister did. And I lied. That was not the last question. We had another one come in, and this person is curious if you have researched the effects of IPV during pregnancy on postnatal development.
Well, that is a fantastic and super important question. Talk about starting early, right? Why wait till the kid's born? Let's see if we can get some, helping going. Okay. One of the people who's an expert in this area studying it, has national grants to study it, is Dr. Alicia Lewandowski. And she is a professor in clinical psych at Michigan State. She was one of my first students, and I adore her. I adore her work. She's looking at this from every angle. First of all, we know from prior research that when women are abused and they're pregnant, a lot of times the violence is directed through the abdomen. So there's a direct threat to the fetus. Not just that, the physiological arousal, all the cascade of hormones going on when there is domestic violence, that can affect the developing fetus. And so Alicia's studies are trying to look at what are the biological effects of being abused while pregnant. What happens to those kids? And she's got a number of grants where they are following these families over time to look at the physical development, the mental health development of these kids, the attachment, for example. Is that interfered with when there's domestic violence during pregnancy, with comparison groups of kids, same demographics, same ages, et cetera, to see what difference does this make. and looking at it, just not just, with questionnaires and stuff, but doing, brain scans, looking at blood tests, trying to figure out hormone levels, like exactly what is going on and what's cascading, what's causing those kinds of behaviors. So we're going to learn a lot more over the years. Other people, she's working with a team from the University of Michigan, Dr. Maria Music and Dr. Kate Rosenblum, and also trying to look at intervention. So what kind of programs can we get for pregnant people to try to make a difference, to try to help reduce exposure to violence, to help them get the help they need? And so there's a lot going on in that field. So another person, Maria Galano, Dr. Galano at the University of Massachusetts, another former student, she is looking at teenage pregnant Latina Spanish-speaking women and their experiences with the IPV, developing and adapting our Moms Empowerment Program actually to work with those teens, bringing in a lot more about infancy in terms of parenting, and trying to design a program that's going to help them to see, and we're testing it now, evaluating it to see if it works. Also, Dr. Laura Miller at Notre Dame, and Dr. Katie Howell, who is at Memphis, University of Memphis. All of these people, my former students, they're all studying some aspect of domestic violence in the community for specific groups of people, for kids and people of different ages. And so, we can look to them. They've already got published papers on some of these issues, but also looking at the future, the kind of work that they're going to do. So there's an army out there, people. We're all trying to figure it out. We're all trying to design ways to help people to get in there earlier, to help kids so that we can reduce the effects. It won't continue, hopefully reduce the future, for future kids and people in relationships so they won't be exposed to this. But that's what I know about that topic.
Thank you, Sandy. Those are all the questions that we have, or that attendees had. Someone did say thank you, that it was very insightful, and thank you for sharing your knowledge.
My pleasure. It's been really, really great. So thank you.
Yeah. Okay, well then I think we're ready to break for lunch, and we'll come back at 12:30 for our panel of survivors. And yeah, everyone have a great hour break.
Thank you.
Thank you, Sandy.